Hi there. There are two questions I get asked all the time, as a pharmacist with over 20 years experience. These are two of the most common questions I get asked all the time. The first question is, am I really depressed? And the second question is, do antidepressant work? And so I'm going to answer the second question. Now, the issue of whether you're depressed or not, that is left to your doctor. But how to make your antidepressant work is the question I'm going to help you answer today. Now, the issue of mental health, I don't want to go into it because so many celebrities from Angelina Jolie to Brad Pitt to Selena Gomez, and even everybody know that mental health is real. So the question of whether depression is real is not something I'm here to talk to you or to preach to you to tell you whether there's depression is real. We all know that depression is real. The one I want to deal with today, the answer I want to answer today is how to make your antidepressant work for you. So let's get into it. So the first thing I always tell people on how to make their antidepressant work for them is, number one, the mindset. What is your mindset? Do you believe when you're told that you're depressed, do you believe it? Or do you shut down and say, no, I can't be depressed? Or that's not possible. It's just like telling somebody, you've got headache, you've got to take some painkiller. Now, for the painkiller to work for you, you have to believe that already that you have headache, or that it's not going to work. So my first thing I want you to also take in when you're prescribed an antidepressant and you want it to work is your mindset. You have to take it in that actually maybe I'm depressed. Maybe there's something going on with me here. Maybe this medication is for me. Because if you haven't got that mindset that you're depressed, then it's not going to ever work. Number two is you have to be open-minded. When people come in to see me, they will tell me, the doctor have prescribed this antidepressant or that. Is it going to work? How about all these side effects? You see, already you're shutting down. Already, even though you have acknowledged that you're depressed, you're questioning the efficacy of the antidepressant. You're already looking at all the side effects. Talking of side effects, you have to know that all those side effects that are listed on the leaflet, it does not mean you're going to get it. Maybe you are going to get it, maybe you're not. But you have to be open-minded. You have to give it a go. You have to try. Because one thing is to believe that you're depressed. Another thing is to take that medication, having an open mind that it is going to work for you. And number three is you have to also believe that there's a plan B. Now, there's so many antidepressants. There is citalopram, there is sertraline, there is, I can't begin to name all of them. There's fluoxetine or Prozac. There's so many antidepressants out there. So the truth is that there will be one that will work for you. But you have to give it a chance. Now you have to, even if the one they have prescribed for you did not work after a while, the chances are there is one that is going to work. So there is always one that will work for you. If the one you're prescribed hasn't worked and you have taken it a good number of weeks or months and it hasn't helped, it is time to go back to see your prescriber. It's not good enough to say, this hasn't worked and so it is not going to work for me. So that is something I want to mention. Also think of that plan B, that there's always a solution. Now, the other point I want to make is about giving it a chance. People think that once you're taking antidepressant for a few days a week, all of a sudden everything will be fine. I don't think so. Now, on average, most antidepressants will take up to 3 to 4 weeks to even kick in, to begin to build up in your system. So give it time, give it 3 weeks, give it 4 weeks, give it 5 weeks. give the antidepressant a chance to kick into your system, because gradually it will work. And also, if it hasn't worked after 3 or 4 weeks, the chances are that your prescriber might decide to increase the dose or increase the strength gradually until you get an optimal level. So once you have taken it 3 or 4 weeks, it hasn't worked, it doesn't mean it's not going to work for you. It might mean that you may have to take it at a higher strength on a longer time. The other point I also want to make is psychological leg up. And what do I mean by that? Now, antidepressant works, but the truth is that if you're also combining antidepressant with psychological help, like counseling, like CBT, like mindfulness, they work together to make you feel better. In fact, the national guidance in UK will tell you that if you're suffering from moderate to severe depression, taking antidepressant alone is not the answer. It will help, but combining psychological or psychosocial support like counseling, like mindfulness, like CBT, these will help combining with antidepressant to make it work for you. Also, family support. We underestimate the support. We need our families, we need our close friends. Maybe you also have some lifestyle changes you have to make. How much do you drink? How much do you smoke? Can you lose some weight? These are the things that will work together to make your antidepressant work for you. So thank you for watching, and like I said, these are the points to consider when you're taking antidepressant. And like I said, these are the things you can do to make your antidepressant work for you. Thank you for watching, and also please subscribe. If you haven't subscribed, please subscribe and also hit that notification bell, so every week as I release different topics, you will be the first to know. Thank you and goodbye for now.